Yes, Chris, good news indeed. Health experts are talking about something called an endemic stage of the disease. That's because California, like most places in the U.S., is seeing a steady decrease in new daily COVID-19 cases. So I asked two Northern California infectious disease experts about how soon we might get to that next phase. In order to talk about the end of the COVID-19 pandemic, we have to talk about the beginning. Any pandemic begins as an epidemic. That's a disease that's spreading quickly in a local region. A pandemic is when that epidemic spreads over a much larger area, as in the case of COVID-19, the world. The word endemic is used to describe a disease that settles into a population at a stable case rate, and while it doesn't go away, can become more manageable, more a part of everyday life.
So in some ways, I hope that it ends up looking like the way we treat influenza.
Infectious disease specialist Dr. Stephen Perotti is the clinical lead for Kaiser Permanente's coronavirus response.
Yeah, we're not quite there yet in terms of being at an endemic state. The good news is that Northern California is starting to see a downturn. And the hope is that over the next couple of months, we will get to an endemic state, which basically means we're at a stable level of infection in the community.
So how and when do we get to a point when COVID-19 becomes endemic?
It's going to be a process that will take several months, but we're going to get there.
UC Berkeley epidemiologist Dr. John Swartzberg says that's if there's no new variant that's worse than the ones we've already seen. But the Omicron variant has infected a lot of people, so that, paired with the vaccination rate, means immunity is high.
In the early spring and later spring, we're going to be dealing with a period of relatively highly immune population, much higher than we've ever had throughout the pandemic, and a disease level that's much lower than where we are right now.
That, plus increasingly available testing and better treatments, mean this spring could put a real dent in COVID-19's impact. And Dr. Perotti with Kaiser Permanente says he's hopeful the vaccine will soon be approved for all kids 6 months and older. And he added that he encourages parents to get their kids vaccinated to protect themselves, protect others, and push us even closer to an endemic stage of the disease where we can see a consistently low case rate.